Hello guys, welcome back to my channel once again in Dental Bytes, and today we're gonna discuss about the various types of tooth in our oral cavity. We all know that there are four types of tooth in human oral cavity. These are incisor, canine and premolars and molars. Okay, incisors are help in cutting food, canines help in grip and tearing food, premolars in crushing of food and molars in crushing and grinding of food. So these are the four types of tooth in our oral cavity, and we know there are two alveolar bone in which the tooth are present. So upper jaw is called the maxilla and the lower jaw is called the mandible. So if we divide, so by the horizontal line we can divide the upper jaw and the lower jaw, and by the vertical line we also can divide each jaw in two halves: maxillary right, maxillary left, mandibular right and mandibular left, according to your patient position. Okay, so if we see oral cavity from the midline, there are incisor, then canine are present, then premolars, and at last the molars are present. There is not be, they are molars, and molars are present. Okay. So if we see in childs or in deciduous dentition, there are two incisor, one canine. There are no premolars but two molars in childs in deciduous dentition in each half of a jaw. So this is maxillary right. In maxillary, this is maxillary left, and maxillary right we also can see like that. Okay, from the midline. And in the adult's teeth or permanent dentition, we can see there are two incisor, one canine, two premolars and three molars. Okay, so each half of the jaw. Now we see every structure of every tooth, and shortly, as we previously discussed, there are four aspects of a tooth. So now we are seeing the maxillary right central incisor. So here you can see this is the maxillary right central incisor. So these two we can discuss about. Okay, so you can see the five aspect: labial aspect, lingual aspect, mesial, distal and occlusal. In our previous videos we all discussed about these aspects. Now we just seeing these tooths. So you can see maxillary right central incisor, then it is the maxillary right lateral incisor situated beside the maxillary central incisor and canine. Okay, so this labial, lingual, incisal aspect or occlusal aspect, then mesial and distal aspects you can see. Here you can see the root portion, here the crown portion, this is the cervical line. Okay, in here the cingulum is present, and this is the lingual fossa. These are the single rooted tooth. There we can see the only single root in this teeth. This is mandibular right central incisor. They are so small teeth in their dimensions. Mandibular right lateral incisor, we can see this. In this mesial and distal aspect, we can differentiate the in mesial aspect their cervical line is more curvature than the distal aspect. In every tooth you can find. Okay, you can see there in maxillary canine. In mesial aspects, cervical line curvature you can see more depression, but in distal aspect there are two less depression than the mesial aspect in cervical line. Here the mandibular canine you can see. Now we can see the double rooted tooth. Okay, this is the buccal aspect. and this is lingual, this is occlusal. Okay, in mesial aspect we can see the all the two roots. Okay, this is the buccal cusp and this is the lingual cusp, or palatal cusp. So second maxillary, second premolar, you can see there is single rooted tooth teeth, and mandibular first premolar, this is also single rooted tooth. Sometimes variation occurs because of exceptions. Mandibular second premolar, you can see this is also single rooted tooth. But the maxillary first molar, here you can first see the triple three roots in a tooth. Okay, so this is the buccal aspect, this is lingual, occlusal, mesial, distal, or are written. Okay, then maxillary second molar. Maxillary third molar is not very important tooth because now they are like extinction in many times. So many times we can't see the maxillary third molar, so it is not discussed about. It is not a matter of discuss today. So we will just discuss about the maxillary first and second. Then mandibular first molar. This is birooted tooth. And this is mandibular second molar. Okay. So these are the all types of tooth in human oral cavity, and the incisor, canine, premolars, molars. So we will discuss further every aspect of these tooths, but today is end, guys. So goodbye and see you again. Bye.